Hi everyone, I'm Steve. I'm here with Dr. Nario. Dr. Nario is at Biointegrative Health Center in Reno. It's a clinic that treats all kinds of different things or ailments or symptoms. Well, the cause of the symptoms. And you can check them out online, Biointegrative Health Center in Reno. I'm Steve. If you want to reach out to me, easiest way is to go to my website, stevemain.com. You can leave an email there, or I think you can even text me on the phone number there. Okay, so welcome, Dr. Nario.
Hi, Steve. Always a pleasure being here. Thank you for the invite.
Okay, so it's middle of summer. It's hot out there. Um, it's pretty easy to get dehydrated if you're not paying attention. You're out busy, you didn't prepare, you didn't take water with you. So, can you just first tell us what is dehydration?
Well, Steve, that is correct. This is the summer heat, and everybody knows there's a heat wave spreading across the nation. So everybody's trying to quench that summer thirst. So smoldering outdoor temperatures that would make us run like bunny rabbits into our cool AC filled rooms. Being indoors during the summer is not sensible, right? Especially when we're deprived from the sun during the past winter, and we as humans and majority of the athletes out there would want to relish the warm weather we have. But again, it's just too extreme nowadays. But the athletes, we want to run, hike, swim, and even get a tan and getting it up to a crisp. So please use sunscreen, just as a side note. And these are all common activities done, but after some time can result into what we call dehydration. So what is that? This is the harmful reduction of total body water in our systems that leads to lowered volume of circulation to our vital organs. So common signs and symptoms that we need to keep an eye on would be dizziness, weakness, confusion, irritability. Well, everybody's irritable nowadays. And even sometimes the moment that you see these symptoms, sometimes there's already severe dehydration. So that's why we need to listen to our bodies as early as possible.
Okay, if you guys are listening to this channel at all, you hear me say all the time, everyone's different. But I'm going to ask a very general question. Um, how much do we need? What should we do? I mean, how much do we need? Now, you're going to be different than me if you're out there listening, but in general, how would you um, tell us, doctor, how much do we need?
Well, Steve, you're correct. That's why I'm going to probably give you generalized suggestions here. But first of all, we need to understand that where do we lose water? So we breathe, we perspire, we urinate, we move our bowels. Those are areas where we lose water. And fluid in an average healthy adult living in a temperate climate, meaning temperate, you have like rainfall and you have droughts. So it's almost where we are. And this is classified that adequate daily fluid intake, people living in temperate climate, for men, that would be at least 15 cups or 3.7 liters. And for women, at least 2.7 or 11.5 cups. And these recommendations also cover fluids from water, other beverage, and even food. And about 20% of the daily fluid intake usually comes from food, and the rest from drinks. Again, we have to remember this 8 glasses of water a day that you always hear from everybody. It's a generalized recommendation. So as you can see, you're still missing some, and you have to consider that it's so hot that sometimes even the recommendations that I just mentioned needs to be increased a little bit, depending on so many factors. And some here it would be again the body weight, for example. That will determine if you need fewer or more than the recommendation, and even other factors such as exercising. So our athletes out there, we sweat, and then sometimes we don't drink, and even during a workout, how intense it is, and for the environment, how hot is it out there, and are we sweating so much, and are we not replacing it during the time of exposure to heat, and again, overall health. For example, somebody having diarrhea needs more fluid. Somebody who actually has heart conditions, you have to have lower fluid intake. And just a side note, beverages such as milk, juice, and herbal teas are mostly composed of water as well. That's part of your fluid count. But be cautious about the caffeinated versions for the reason that it can actually be a diuretic rather than filling up the spaces of lost bodily fluids.
So, what if someone gets dehydrated? I mean, now you've kind of told us some things what to do to stay ahead of the curve, but what if someone gets dehydrated? What should they do?
Well, Steve, that's a good question. So now this is where the problem solving comes in. In our situation, yes, IV therapies is what we do here in the clinic, but also oral fluids can work a lot. And key here is prevention. Recognition of the early signs, such as too much sweating, thirst, and dry cracked skin or lips, lowered urine output, and even dark yellow urine, something like, oh, diluted urine as we call it, are clues already for us that the body's talking and say, hey, I need something. I need hydration. Once noted, oral hydration needs to commence. Almost any type of fluid can contribute to replenishment. Sad to say, though, you have to be careful again about coffees and alcoholic beverages because they can be diuretics. But most important one to take note of and easy to get a hold of is water. And dehydration sets in as we speak. Now you have to make sure when dehydrate. So I have to make sure that everybody understand dehydration are manifestations of symptoms already. So that's why it's always need to. We always need to recognize the early symptoms. So, but once dehydration is diagnosed, oral rehydration solutions such as powder drinks, such as Pedialytes tablets, now needs to be used. The reason why they're important because they have electrolytes, sodium, potassium, chloride, even glucose, meaning these particles are actually similar to what our bodily fluids have or even our blood so that it can be replaced in the same quantity or the same equivalent. And again, be careful with the sugared ones, especially the commercial ones like soda, energy drinks, sports drinks. Usually, as has a lot of sugar, which are also calories in the body that is kind of dangerous for us to take, especially if we have diabetes or sugar problems. But the problem is very plain and simple. Just going to our own intervention here in the clinic, we offer IV therapies. Sometimes we add vitamins in there, minerals, and amino acids. But the most common ones that we use for rehydrating our patients would be saline, lactated ringers, and dextrose, depending on the situation of the patient. And the fact is, nothing beats continuous oral hydration throughout the day. By drinking good quality alkaline, BPA, and heavy metal free water, we will be assured that we can enjoy a cool and refreshing summer.
Okay, so it sounds like at the beginning you were saying we could kind of see these symptoms coming days ahead of actually being dehydrated. Am I right?
That is correct, Steve. That's why
Yeah.
we need to listen to our bodies. Even just like the light cracking of lips, you might think, oh, I just need some chapstick. But that's actually sometimes when you reassess that, hey, I haven't drank for like hours because I'm so busy at work.
Yeah, that's the one that caught my attention.
Hmm.
Something that fast. I mean, dehydration can affect you that fast, and I don't know. It sounds like it could be even days that you can see that coming, and you start preventing the dehydration right away.
True.
Okay, so that's Dr. Nario, Biointegrative Health Center in Reno, Nevada. You can look him up online. Thanks for being with us, Doctor.
Well, Steve, thank you again. Always a pleasure. As we all know, knowledge is power, and thank you for letting me provide you with the edge in longevity and health maintenance, which I call the biological edge or the bio edge.